want to get started by introducing myself and the team. This is Eric Bruns from the University of Washington Wraparound Evaluation and Research team. We'll get on camera here in a second, I think. But we are just so excited to have folks here. Looks like we got almost 100 folks on the webinar at this point. Oh, here we are. Thanks, Jacob. So this is going to be pretty informal. We're going to just share some things we're learning as we learn them about over 15,000 young people entered into our data system called WrapStat. We're going to share about what we've learned about the young people who are in the system, the organizations, over 50 organizations across the country. Over 500 sites are logged into WrapStat. Katie, who will introduce herself in a second, has been one of the members of the team who has been here at Wraparound Evaluation and Research team that works with WrapStat users, Wraparound Fidelity Assessment System licensees to get set up in the system. And she and John Olson are going to be my partners in presenting some of these very first insights that we're learning. Maybe each of you can introduce yourselves. Katie, you want to go first?
Hello all, I am Katie Renteria. I'm one of the research study assistants on the work team, and I'll be, as Eric mentioned, helping present today.
Thanks, Katie. And John?
And I'm John Olson. I'm a research scientist with the team, so I'll be talking about some of our data slides. I'll apologize, my voice is coming back after being sick last week, but it's still a little off. So I will muddle through several slides later in the presentation, but I'm excited to share some of what we've learned with you all today.
Thanks so much, John. We're just so excited to do this. So just a little background, Wraparound Evaluation Research team. We are 8 strong as of now, and you heard from John and Katie. We also have a couple other folks who, those of you who are using our tools, probably have interacted with over the recent years since we launched WrapStat in 2020. These include Leah Musumeci, who is one of our research coordinators, Catherine Soon, research study coordinator, Olivia Linkus, and Jade Andorra, our research manager, and our newest team member, Kristen Vick, who has joined the team just in the last month or two. So this is the Wraparound Evaluation Research team here in Seattle, Washington. It's just been such an incredible journey for me personally to be able to build this team and have it transform over the years. It's been now almost 20 years since I came to the University of Washington and we started the team. When we started back then, Wraparound was just being defined, and now we've evolved to this place that, you know, wouldn't have known we could ever get to, where we have a national community of practice all collecting and contributing data into one system that helps us understand how wraparound gets done out there in the world. Systems of care get provided to young people with complex needs and their families. And just one last little bit of storytelling. When the version of the Wraparound Evaluation and Research team that existed in 2018, or maybe it's 2019, we had a retreat on an island in the San Juan Islands out in the Puget Sound of Washington State. And we were taking stock of all the work that we do in Wraparound as a team. You know, John wasn't even part of the team yet. Since John came on board, we've done so much more research, publishing of findings. We've published a meta-analysis that shows about Wraparound's outcomes and under what conditions positive outcomes happen. We've been doing that for many years. We had the Fidelity tools. We were working with folks to get them used. But the biggest priority that the team came up with as a team at that retreat was we need to help our wraparound providers who use our tools do so in a way that's more rigorous. We were really concerned that the way this would get done is people would say, yeah, I want to use the Fidelity Index, or I want to use the team observation measure. And they would just go out and collect the data for a random group of 20, caregivers, or observe, 8 or 10 team meetings. And then they would send a report out to their stakeholders or look at it internally and say, wow, look at our fidelity. It's so strong. Our satisfaction's so good. But they were collecting that on 15, 20 caregivers out of hundreds that they served, the easiest perhaps 15 to get. What we committed to back then, and it's been a hard road, is building a system that does a few things that allows the users of our tools and wraparound provider organizations, care management entities, states out there do that work with more rigor, using a system that helps you keep a whole roster of all your youth being served, sample from it so you can get representative data, good data, and a place where all that will live so we can learn together. We'll talk about that today. But first, let's hear a little bit. Let's launch our first poll. So we see who's with us here. Thanks for putting that in the chat. We got folks from all over the country. How about you as an individual? What best describes your role in wraparound? Are you a state level person, a wraparound provider organization person? Are you a practitioner? Are you with a family or youth organization? Are you a researcher or evaluator? Or other? You can just tell us in the chat if it's something else. So yeah, feel free to tell us who you are, and we'll look at the results there in a second. While you're doing that, I'll kind of get us started here. What we're going to talk about today is we're going to walk through the data that many of you might have seen in an infographic that we sent out to the Wraparound Evaluation Research Team listserv, the National Wraparound Initiative listserv, that just tells us some of the first things we're learning about our Wraparound Fidelity Assessment collaborators, who are collecting these data, who are putting them into WrapStat, and we'll talk about what WrapStat is along the way as well. Okay, so go ahead, let's see maybe the results of the poll. Got some other folks kind of putting their stuff into the chat. So we've got a good number of provider leaders, about a third, and then a third researchers or evaluators, and then a sprinkling of state folks, practitioners, and yeah, some other folks, National Wraparound Coach. Thanks, Jared. We've got a youth partner, we have a QI data person, and so forth. So thank you. We got a diverse group here. Fantastic. So what is WrapStat? WrapStat is first and foremost about making sure of our fidelity tools. The Wraparound Fidelity Index is the survey. The team observation measure is an observation tool of team meetings. And then the Wraparound DART, just getting started out there at scale, but it's been incredibly powerful for a few states who are now using it in multiple waves year after year, seeing their improvements, seeing the impacts of what kind of quality improvement processes they have put into place. The DART can be a really great way to do that. So 3 fidelity tools. And the whole idea here is to provide a complete picture of how your wraparound initiative's going. I know a lot of you have seen this 100 times now, but I just can't launch into what are our tools, why do we collect them without getting the full picture. The most important thing, and this is a little bit of a preview of some lessons we're learning already from WrapStat that we've got to deal with, is the most important thing is outcomes. If we are not getting good outcomes, if we are not tracking outcomes, then we are missing the point here in our work in systems of care for kids and families. It's all about achieving outcomes. That means we need to know what the outcomes are, folks. Along the way, we know things influence outcomes for kids, whether they're at home, in school, and out of trouble. Fidelity, quality of services, but it's also about the system. We call the outer context, that's what we call the systems and the policies and the funding. And then there's the inner context. That's our organizational characteristics. How well are our wraparound provider organizations set up to do this work well? And it's cool that we've got state folks who would be out here at the outer context. We've got provider folks who'd be here at the inner context. But these things all influence outcomes, but the outcomes are the most important thing. So then we have a measurement strategy to get there. So what is our measurement strategy? To get to outcomes, we've got to consistently measure whether needs are being met, whether kids are at home, in school, out of trouble, right? Other measures, mental health, functioning, all really useful and good, but the core outcomes, at home, in school, out of trouble, we want to make sure that we've got young people who are able to live and thrive in their homes and communities. Fidelity and implementation success, that's where those fidelity tools and other things come in. But in terms of what we provide, the Wraparound Fidelity Index surveys get its satisfaction, caregiver youth, care coordinator reported fidelity and outcomes. The TOM is a team observation measure. The DART is a document review tool. We're not going to get into dwell on the tools themselves much today, just what we have in terms of data on the tools, yes, but not the tools themselves. You can go find an older webinar on the National Wraparound Initiative website if you'd like to learn more about the tools themselves. Here's the biggest thing we do now at the National Wraparound Implementation Center. If we're not actually coaching at the system and program level, we think that's as important as training and coaching practitioners, because it's all about how well our systems and our programs are set up for success. So we have measures of achieving wraparound implementation standards at the program level and the system level. If you get training and coaching from the National Wraparound Implementation Center, that's what we're going to be training and coaching you on as much as anything. And we collect data on that as well. Okay, so let's keep moving forward. Why do we collect all these data? People have seen this, you've heard this 100 times over. John Olson led our meta-analysis to confirm that wraparound conditions, kids enrolled in wraparound in controlled studies get better outcomes than services as usual. But as shown from these bar charts, if you have average or higher fidelity, those outcomes are a lot better than if you have below average fidelity. In every single one of these outcomes, mental health, functioning, residential, and combined, we need to get our organizations, our state initiatives to do high quality wraparound that is true to the model. I'm not going to dwell on this. People have seen this and heard this many times over. So this is one way of depicting the why of why we measure what we do and why we try to get to what we do in terms of fidelity and quality of care. Okay, last thing, and then we'll talk a little bit about WrapStat and the data we're looking at. We can benchmark based on these data that we collect what represents adequate fidelity. When John did that meta-analysis and broke out the sites that had adequate or high fidelity versus below adequate fidelity, it's because we have looked at the data and determined what, for example, a WFI-EZ, a Wraparound Fidelity Index short form score is that represents adequate or high fidelity. And we can only do this because of all of you who are using the tools. So this helps us stay on track as well. So our vision is that all wraparound initiatives will have high quality data that they can trust and use, and that the wraparound community, all of you plus thousands of others, can turn to us at the Wraparound Evaluation Research Team at the National Wraparound Implementation Center as a trusted source for research and for data support. And to do so, we feel like we need to be able to do this work with rigor. And that's why we created the Wraparound Fidelity Assessment System measures and why we created WrapStat. So with that, I'm going to turn it over to Katie, who I think is going to take over from here for a few slides to tell us a little bit more about WrapStat. Katie, you ready to take it over?
Yep. So here we have another poll. How familiar are you with our RAFIS tools?
Thanks, Jacob. So this will be real interesting to see how many folks are using the tools, maybe familiar with them but not use them. Maybe you're brand new to this whole thing. So we'll see here how much we can speak to those who are at least somewhat converted to the idea of measuring fidelity and using those data. So please complete the poll here. My guess is we're going to have about at least 50% very familiar. Let's see what the results say. What is that? Was that Price is Right or no? Family Feud survey says. All right. What does the survey say, Richard Dawson, otherwise known as Jacob? Ooh, I'm very close. 46% very familiar. Oh, we got a good number of folks who have never seen or used the tools. All right, so folks need to know that the tools are described. Maybe someone from the team can put into the chat where they can go to find a summary of the tools and WrapStat on our website. So this is very useful. Thanks for folks for completing the poll.
Yeah, and it looks like we have a pretty good mix, as Eric mentioned. And whether you're familiar or not, hopefully this presentation drives home the importance of not just collecting evaluation data, but collecting it in a comprehensive and rigorous way, as Eric mentioned. And that's where WrapStat comes in, our data management and reporting system. The system has a place for you to house your youth roster, which it pulls directly from when setting up your evaluation cycles. Oh, too soon, Eric.
All right, there you go.
It also houses the WAFIS tools, making them easily accessible to administer and collect the data directly from WrapStat. And WrapStat culminates all of this information to easily view demographic, fidelity, and outcomes data. Now you can switch to the next one.
All right.
So by being such a comprehensive system, it allows users to get a full picture of their data quality, fidelity, and outcomes. One of the ways WrapStat helps promote rigorous data collection is through its built-in feature of generating a random sample, which I mentioned is pulled from your youth roster, and this helps prevent convenience sampling. And WrapStat also promotes high response rates by having a built-in message center, which can send automatic reminders to folks to complete their surveys. And it has built-in dashboards to help you track your data collection success along the way. I'm good for the next one. One of the other features of WrapStat, like I mentioned a few times, is the youth roster. And as you add your enrolled youth to the system, it allows you to track and enter data on things such as length of enrollment, reason for discharge, and data on residential, school, and community outcomes and levels of needs met. Tracking this data allows an organization to gain a full picture of who they are serving, and thus increases their understanding of their fidelity data. And additionally, the dashboard features and canned reports within WrapStat do the job of analyzing and culminating the data in a way that makes it easily digestible.
Yeah, and we're not getting into the details of WrapStat today, but again, you can see webinars on the topic, summaries of WrapStat, and the tools going to that link that Kristen put into the chat. Maybe someone could also put a link to the National Wraparound Initiative webinars, and you'll see if you really want to know more about individual tools or WrapStat, you will find old webinars on the topic.
So we have another poll. Now that we've talked a little bit about WrapStat, its functions and capabilities, we are curious how many of you who said you are WAFIS users also utilize WrapStat to aid in your data collection efforts.
Yeah, why don't, and everybody can reply to this just so we can see what the proportion of everyone on the webinar is, not just if using the tools. Really be interested in knowing if we're talking to folks who might have familiarity with it, might give us a little sense as to how we tailor our message here, because we're talking about the data that we're collecting in WrapStat. Folks who are using the system will probably be the most interested in this, but even if you've never used a wraparound tool, maybe this will help you understand a little bit about what our quest is to get as many wraparound initiatives using the system, and a little bit about, how wraparound is going nationally. So hopefully the webinar is useful for everybody, but yeah, let us know. Do you use WrapStat currently? Some folks might have used it. Some people might use our fidelity measures, but not use WrapStat yet. So it's not like it's a one-to-one correlation. All right. So let me guess now. I'm going to say 32% are going to say they use WrapStat currently. That's going to be my guess. Let's see what Jacob says. 43%. All right, very interesting. So almost the same percent that are using the tools are using WrapStat.
Yeah, it's a pretty good split. For those of you who are using WrapStat, and I guess everyone kind of said at the beginning which state they're working from, but we're curious which state you're in, because in the meantime, I'm going to pass it off to Eric to talk about who and where our collaborators are. So it'll be interesting to hear from you all, see which states you're in.
Yeah, so if you're a WrapStat user, if you said you are one of those folks, put into the chat, just put the state. I know we saw lots of different
Oh, hi, Danielle.
organizations. Who's that? Who'd you see?
Danielle, Oregon.
Oh, cool. Hi, Danielle. So yeah, maybe I'll let Katie digest that, and I'll just show you a map.
New Mexico.
According to our, oh, go ahead.
Oh, just recognizing some of the names. I'm the hidden face behind the WrapEval account, and so I email with a lot of you, and so I'm excited to see that you're all here.
Well, you should put your face out there so people know who the face is behind the email. But anyways, we were looking at the data, and this is a map that overlays two different things, talking about how our wraparound tools are all across the country. Not everybody who uses the tools have gotten into WrapStat yet, but we do know that across the country, there's only about 6 states that we haven't seen any presence of wraparound fidelity assessment tools being licensed. The dark purple states are places that have invested in WrapStat, in the fidelity tool somehow or another statewide. A good number of those you're going to see also have a little turtle on them. In fact, the majority of the dark purple states, or I should say the majority of the states with a little turtle, those are states that either currently or in the past, and thanks to Kristen for pulling this map together, have had contracts with the National Wraparound Implementation Center at the Innovations Institute at UConn. Used to be University of Maryland, Baltimore, moved to UConn this year, University of Connecticut. But anyway, so you can see all across the country, you got 20 states or so that either currently or in the past have had contracts with us to do training and coaching on wraparound. And just about every one of those states that NWI has been in is also a statewide wraparound fidelity assessment system tool user. And that's because if you're an NWI state, if you're getting training and coaching from the National Wraparound Implementation Center, part of that is you get support from the Wraparound Evaluation and Research team. And that would be around evaluation and data and fidelity collection. So you can see our presence. And, Katie, what are you seeing in our states? How many states did you count?
Do you mean in the chat? I haven't counted up. I haven't counted everyone in the chat.
Okay, just curious if you see a good representation.
There is a really good representation, though.
Cool. So here's the other last thing I'll say about our sites. All right. So, and then I'll hand it back to Katie to talk a little bit more about who is using the tools. So this is just, again, I know a lot of people are like, I don't want to hear about this stuff. I just came to hear about wraparound or data. But for us at the Wraparound Evaluation Research team, this is like the achievement of a long dream, right? That we would have an understanding of wraparound implementation across a diverse set of states, a diverse set of types of organizations. So we have 49 wraparound initiatives in our system, and that includes 18 provider organizations, 9 statewide configurations. We heard that Oregon's in the house. That's a big one, right? State of Oregon, lots of other states, 9 in total in our system. But there's different state systems that are the kind of licensed user. So behavioral health systems are 6 of those 9, but also child welfare and juvenile justice are the actual licensees. They may very well be representing a coalition of multiple child serving agencies, but in terms of who's our actual licensed user, 6 mental health, 2 child welfare, 1 juvenile justice. And we got 12 care management entities that are in the system. And those are sometimes part of statewide initiatives, but the care management entity, if the care management entity is the licensee, then we counted them here. A couple of managed care organizations, and then a couple of counties. And finally, 4 universities are our licensees. Again, the university might be a licensee, but it's part of the state rollout of wraparound. So it's not like these are mutually exclusive. We might very well have more than 9 statewide wraparound initiatives using the system. But in terms of who are the licensed users, 4 of them are universities, typically on behalf of a state, and same thing with care management entities, 12 of those. But again, vast majority, like in New Jersey has got care management entities. that license with us independently, but New Jersey is a statewide initiative. So this is very interesting to us. Again, it's kind of like the achievement of something we've been shooting for a long time. Tell us a little bit more about our licensees that you work with, Katie.
So just a quick side note, for some reason, it doesn't allow me to respond to everyone in the chat, only the hosts and panelists, but just wanted to give another shout out to our California friends. But as Eric just talked about, we have 49 different wraparound initiatives that contract with us to use the WAFIS tools in WrapStat. And our collaborators range from small individual providers, which would be represented in WrapStat as just one site, all the way up to full states, which might be configured in such a way that allows them to filter their data by region or county and then down to the provider site level. But no matter how large the initiative, all the data itself lives at the site level where the youth are receiving the wraparound services. So with that in mind, we take a look at this graph and we found that across the 49 contracts, we have 514 sites in WrapStat. And as you can see from the first column, the majority of folks who contract with us are smaller organizations comprised of just one site in WrapStat. 15 of our contracts have 2 to 6 wraparound provider sites. 9 of them have 7 to 16 sites, and 3 of our contracts have between 17 and 36 sites. And these middle bars are more representative of counties with many providers or large wraparound providers who might implement wraparound across various counties in their state. And then at the end, we have 3 contracts that have more than 60 sites in WrapStat, and these are some of our state contracts. But as you saw in the previous slide, there are more than 3 statewide initiatives. It's just that not all of the states we work with or who use the WAFIS tools also utilize WrapStat, because again, this data is coming directly from WrapStat. So within the 514 sites, there's 15,427 youth who were entered into the youth roster as being enrolled in wraparound between 2020 and 2022. And this chart shows the breakdown of number of youth entered into WrapStat by each of those years. So we see a large jump in youth between 2020 and subsequent years, which could have many explanations. WrapStat was fairly new in 2020, but COVID could have also played a part, including something else we hear really often, which is difficulty with hiring and retaining care coordinators. But these are just speculations. And by looking at the data, especially that of the organizations who collect high quality data, we can start to paint a larger picture of the barriers to doing wraparound and then feed that information back to the community.
Yeah, this is just, again, what a dream. This is like, this is what we were really hoping to achieve someday. You all who are on the line right now, 100 folks from across the country, are our community of practice. And we're going to try and figure out how to bring even more of you, users and non-users, into a group that is looking at these data, you know, on a regular basis, talking about what we're seeing, learning from it, publishing on it, using it to inform the training and coaching we do all across the country. So this is just a dream. But I'm going to presage something before I hand it to John, which is that we see this incredible number of youth records. This is just incredible, right? 15,000. And that was after removing about 3,000 that were duplicate, test data, and so forth. But anyways, 15,000, and that was just through 2022. We're halfway through 2023 now. As you'll see, the biggest number of youth records entered into WrapStat was in 2021, which was the first full year of WrapStat. But you'll see in a minute that the number of tools, fidelity tools that were entered, really was the greatest in 2022. So, you know, the story here is people were just getting started in 2020 with WrapStat, getting set up. We were still finishing the system. 2021, first full year, still finishing the system, but, you know, people got their youth rosters bulk uploaded into the system and really started using the fidelity tools at a scale in 2022. But here's a preview of what the rest of this session is going to be about. Is Does that mean that we've got 15,000 kids that we can look at fidelity and outcomes and learn from? Not so much. So with that, I'm going to hand it to John, I believe, to talk about what we learned about the young people in the system.
All right, yeah, thanks, Eric. So I'm just going to go through some numbers really fairly quickly here, and you'll see what Eric has already kind of foreshadowed of where we have decent data in terms of representative data, and where we have a lot of missing data. And you'll see as I go through these next several slides, some of these we have data on all or nearly all youth, and then as we dig in a little bit deeper, we see, especially on some of the optional items, we don't have some of the demographic information that would be ideal for digging in deeper. So this first slide just shows ages, that simple distribution of the age range of the youth that we have in WrapStat. The bulk fall between about 11 to 17 years, which is about what we would expect. Let's go to the next slide, Eric. And here we get at some of our fidelity data. Excuse me. So we have here that limited just to the WFI-EZ and the TOM data. As Eric mentioned at the beginning, we're just starting to see states really take off with the DART. So we don't have as much DART data yet in WrapStat, but that will be growing over time as well. On this slide, you can see that we have the care coordinator version of the WFI remains the most popular, followed closely behind by the WFI-EZ caregiver version, with the team member and youth forms not used as often by those that are entering data into WrapStat. TOM is not used quite as often as the WFI-EZ, but we do have a decent amount of TOM data in there as well. And as you can see, just like the trend of general data collection going in, as Eric mentioned before, every year we're seeing more and more use of WrapStat for these data. So 2020, we're just getting rolling, and then by 2021, a little bit more, and by 2022, we have quite a bit of data coming in. And I'm always really excited. These are the data I dive into more than probably anything else, is looking at our fidelity tools, and having WrapStat now, and having all these demographic variables that we can start to look at. Where is Wraparound working well? How are satisfaction numbers? What are outcomes looking like across different demographic groups? So on the next slide, you'll see a couple of things. First, we get into some of the demographic data here, looking at gender. But some of you might notice that now we're talking, as the slide that Katie reviewed, we were talking about 15,000 some odd youth. Now we're suddenly talking about 8,000, right? So it means that we're not getting some of these demographic data put in or entered into WrapStat. And we'll follow up on this, and Eric will talk about some of our kind of implications for moving forward in trying to get more data on some of these demographics. But what we have for 8,000, so more than half the youth that are entered into WrapStat, we do have decent data on gender. These are along the lines of what we'd expect, where we have those that identify as male being the largest group by a little bit over those that identify as female, and then a broad variety or distribution of those within the other category, ranging from, I'm not going to read every number here, but while the percentages seem small, out of 8,000 youth, we do have like I said, a distribution of gender identities that are represented in our WrapStat data. All right, let's look at the next slide. You'll see the numbers start to get even a little bit smaller. So those that have race data, we have 6,400 youth, where we have racial ethnic data. Largest group, again, not surprisingly, are white, and that includes white non-Hispanic and those that identify as white Hispanic, Black or African American, and then a host of other categories of racial identities that are represented in our data. About, if you pull out just the ethnicity data, about 2/3 identify as non-Hispanic or Latinx, and about 1/3 as Hispanic or Latinx. So again, we have decent data here, but the level of missing data is kind of growing. You'll see that on the next slide. We just give a basic summary of what we have in terms of percentage of youth who have valid data across a variety of different demographic and other kinds of variables. Date of birth, I'm not going to read every one of these, but date of birth, 64%. Some of these you already saw. Our gender, It's 43%, race and ethnicity, 34, 32%, and so on and so forth. When we get down to the second row of data here, referral source, referral date, referral reason, by the time we get to referral reason, we're at only 6% of those youth that are entered into WrapStat have actually valid data entered for referral reason. It jumps back up a little bit at our discharge data. So looking at exit date, exit reason. Now these are only for this particular slide, have only the data drawn from 2021, I believe we brought in here, with the idea being at this point, we should have discharge data on many of these youth, and we're only getting it for about, especially exit reason, only about a quarter of youth. And really, that's one of the main outcomes that we're most interested in when we look at wraparound. We want to know, are youth exiting? When are they exiting? Why are they exiting? Where are they going? So to really answer some of our deeper dive questions that Eric will review a little bit later today, we really need to find ways to increase the data that we have there. One other really quick comment on this, you'll notice the sample size here jumped a little bit to nearly 19,000. I'm including all years here, not just the 2020 through 2021. So this includes data that were entered into WrapStat retrospectively as well, when people entered into using WrapStat as a system.
So we've got a great point, some great points, and a question, important question. So some of the points people made in my question, does the youth roster not have basic demographic data? And people are just saying, well, because they're not required. So we require age because it helps make sure the system knows whether, if you're doing a WFI-EZ, if the youth form is something that would be relevant, right? We require the date of enrollment because we want to be able to consistently track, because the system needs that to know whether or not to include it in your sample when it's time to pull a sample that you're going to use to go get WFI-EZ or TOM data. So we require a couple things, and of course, if you require it, it's like 100%. But we don't even require gender. We wanted to make this as, indeed user-friendly, but folks are saying they just don't even include it because you don't have to. Now, then a couple of folks made some good points, right? The demographic data we're sharing is from the youth roster. If you do the WFI-EZ, there will be a record of the gender and race, etc., if the respondent chooses to enter those data or to include those. But we strongly believe that if we're going to make the most of these data, we need it for all of your youth. So we can ask, who is everyone you're serving? If you're serving 1,000 folks in your state, we don't want you trying to get 1,000 WFI-EZ surveys. We want you to get a representative sample. But that doesn't mean we don't want to know who all of your young people are you're serving. So, but people are making a good point that you could go get these data. We could go get these data from the WFI-EZ surveys, etc. But I just think that it's important to point out that that doesn't mean that you're going to have it for everybody if you don't put it into the youth roster. So we think that's important. Then the other point is that the WFI-EZ does not tell you what the discharge reason was. So we're only getting a quarter of our young people with a recorded exit reason. Was it a successful transition or something that was due to a lack of engagement, placement out of the community, etc. And so again, without these data, we have less ability to really make sense of what's going on and for you guys to, do the same. So that's the editorializing that we'll just keep doing here as we finish up the presentation.
I'm going to take just a couple more slides and I'll hand it back to Eric. So of the youth, where we do have this.
Oh, sorry, I just want to point out there's a question that's still in there in the chat about what is the percentage of youth served that constitutes a representative sample?
Oh boy. So now this is why we created WrapStat, right? Is that if you actually enter data on all of your youth being served and their date of enrollment, again, only a couple of required fields because it's what's needed to even pull a sample. WrapStat will do that based on your parameters. that you decide to enter. There's no magic number. We give you recommendations. WrapStat will then pull that representative sample from your pool of all youth in your roster. So you have to bulk upload or enter all of your youth if you want to use that feature that pulls a representative sample. Our feeling is that, you know, it really depends on a combination of things, including how many subsites do you have. So if you're a state of 1,000 and you have 20 provider organizations that you're contracting with, if you want to get data that is representative of all of your provider organizations, because each one, as we see from our wraparound implementation standards data, each one might do a better job, you know, do a different kind of job of quality wraparound provision. If you want to get everybody in your sample, you're going to need to pull a bigger sample than if you only had 3 care management organizations, because you would want to distribute your sample across all of your organizations if you want to get a picture of statewide wraparound. So it really depends on your your organization's configuration and then how much resource you have. So we give you the flexibility to decide, do I want 10% of our 1,000? Do I want it to pull equally from each of our 20 or our 3 sites? So WrapStat will do it for you based on the parameters you put in there. And our rules of thumb are, you know, make sure that you've got, you know, you're pulling at least 10 to 20% of all of your youth being served, depending on how big you are, or a minimum of at least 15 youth if you are a smallish provider site. So if you're only serving 30, we're not going to say pull a sample of 10, because 3 would not be a very good sample size. But if you're a program of 1,000, you might be able to pull a sample of 100, maybe even just 50, if it is truly representative of all of your kids, and have a good representative sample that tells you how families feel about their care. Hopefully that makes sense.
All right. Well, let me just jump into these last couple of slides on data before we start talking about some of the lessons learned. And Eric will actually dig a little bit deeper into some of this, the data that we do have on discharge. So this slide simply shows the distribution of time to discharge for youth. It says here, you know, 53% of youth discharged between 2020 and 2022 were enrolled for 9 months or less. You see there's you know, a tail end of that distribution, and then you see a bump up. It's just because that's a catch-all at the end. So it'll take us to dig in a little bit to see the reason why we have some youth that are in the system longer. Is that a figment of the data processing that these youth have not been removed, or are they actually still actively enrolled? So some sleuth work for us to do as we move forward. On the next slide, which I think is in many ways some of the data that are most interesting, and again, we make the point here again of some of the missing data, the 7,400 some odd youth records, where we do have youth who were discharged between 2020 and 22. About 60% had a reason for discharge listed. So again, it gets into that, you know, we're really excited about the data we have. These are some of the outcomes we're most interested in really taking a look at and tracking over time. And we can kind of start to compare across different subgroups, different demographics, different organizations. And as Eric said way at the beginning, bringing out that kind of called the CFR model of inner settings and outer settings and all those pieces, we can start to piece together what are the conditions under which we get to some of those outcomes. And we're hoping to start to narrow that light blue bar here on this chart so that we have more data on the actual discharge with a reason, so we can track that over time. And you can see over time, we are, just like every piece of data in WrapStat, we are growing the amount of data that we have over time. So I'm going to hand it back over to Eric to talk on the next slide a little bit about some of the reasons for discharge in terms of those valid data that we do have and some of the interesting patterns that we're starting to see.
Thanks, John. Real big shout out to Olivia Linkus, our team member, our research coordinator, who tried to make as much sense of our discharge reason data as possible. It's complicated. right? We have a pick list in WrapStat because, again, we really believe that at a minimum, we need to know, the most basic minimum, we need to know whether the young person's discharge was for a good reason, maybe a bad reason, maybe a neutral reason. So we ask, was the discharge due to meeting goals? Was it a successful discharge? Was it perhaps not so successful discharge? Didn't get through the plan of care, did not get to formal transition, left wraparound before needs were being met. Good number, never began. They got entered in the youth roster. This is fine, but tracking these things consistently is going to help you as a state or a program, and us as a national research team working with you all to understand what might be the reasons that wraparound is successful versus not. Does it relate to the length of stay? Does it relate to the age? Does it relate to the system? Does it relate to the quality? Does it relate to the fidelity? So we need folks to try to put those discharge dates and reasons for every one of your youth roster youth. So here is this, the data on what we have thus far, just beginning to figure this out. 51% successful discharge. Again, though, what about those 40% where you entered a discharge date but didn't say why? Maybe you didn't say why more often if it was unsuccessful. We don't know. We need data completeness to be able to feel like we really know what's going on in your state, your program, or nationally. Big thing here also for us to work out at the UW worked is the other category. So we have this pick list, but 10% picked other. And what's really interesting is that individual programs or states, sometimes they are putting their own categories into other. Interesting, probably understandable. You all have your own terminology that you want to use, but it makes it harder for us to figure out what the patterns are nationally. So we got to figure out if this is something we want to roll with, work with each state or site that has these kinds of individual terminologies, planned termination versus unplanned termination, etc. Or how we want to manage this. It's all well and good, but we need some rules. Do we need to change our drop-down menu? Do we just need to work with these states that have their own terminologies to assign them to our pick list, etc.? So if you look at other, the main thing that pops out here is that new placement was only 7% of the other category, which is only 10%. So theoretically, we're seeing only about 1% being, officially ending wraparound because of a placement. Got to ask, if there's a way to better, kind of characterize the reasons for ending wraparound and make sure we got the full picture. So if it's interesting, we're just getting started here. Those of you who are seeing yourselves in these data, we're going to be talking with you about this now that we're understanding how this is working with our users.
And Eric, we have a question. Is there a correlation or relationship between length of stay and successful met goals?
Well, that's what we want to kind of do, but we can't do it without good data. So let's all pitch in and try and be as complete with our data, including exit reason. Right now, only 25% have an exit reason. Okay. The other thing is that if we really want to understand what's getting to outcomes, we have 15,000 plus youth records. We only have about 5% of our users, not our users, but 5% of our total youth roster where we have some of these outcomes we put in. They're optional, but we really want to make sure that, if you're a site who really wants to contribute to learning locally and nationally, telling us whether or not there was a juvenile justice involvement, any kind of negative school outcome, out of community placement. These are the kinds of things that really start to tell the story more so than just discharge reason. And we're only getting this for about 5%, only a couple users using those outcomes. We got to figure out who are using them and ask how we can get them to be a model for the rest of our sites. So this was a great segue, that question. What's the relationship between length of stay and discharge reason? Tell us, what kind of information would you like us to learn on behalf of the national wraparound community or your program? What kind of questions would you like us to ask of this? Lots of stuff we could do, and we're going to share it. We're going to be coming back to everybody quarterly or so in a community of practice of WrapStat users to talk about what we're learning. So tell us right now whether you're a WrapStat user or not. What do you want to learn? What have we learned thus far? We have diverse types of so put it in the chat. But we have diverse types of initiatives. We got providers, states, counties, CMEs, universities. Nearly half of our organizations are single sites. But we got 3 statewide initiatives with more than 60 sites that are in there, which we're looking to grow that number. We want to support statewide wraparound with good data. What else have we learned? Who we are and what data we have. We have diverse youth. Only about we got about over half of our youth are non-white, are BIPOC, are Hispanic, Latinx, African American, other BIPOC categories. The median length of enrollment is about 8 months, but what a big range you saw, with a large proportion seemingly being enrolled for over 2 years, right? And over half discharged successfully, but our discharge reasons are hard to interpret and somewhat incomplete. We learned we need better data completeness. Less than half of records include even gender and race. Less than a quarter include the referral source or discharge reason. And barely any sites enter info on, did the family make progress towards their needs when they discharged? What was the level of progress? And what kind of community outcomes were we able to achieve? Here's some good questions to ask. How many youth have natural and professional team members, and how does this affect their exit reason? We can do that with data from the Fidelity tools combined with your discharge reason or your outcomes like progress towards need, staying at home, in school, and out of trouble. Does WrapStat keep track of when a youth is transferred from one wraparound facilitator to a new one? We can't. WrapStat tracks who their care coordinators are, but I think we'd have to ask that question. I don't know if Katie has an answer to that. You certainly could combine data that you have locally or from your program level, your program survey that we administer every year. But it might be a bit of a job of pulling data from both sources and putting it together. I don't know if you have any thoughts on that, Katie, if you've ever done that with a site.
So they can put in the youth roster, when they're entering all the information for the youth, there's a spot to put who their facilitator, or as we like to call them, care coordinator, in there. And when a survey or a TOM or any of our tools are conducted on that youth, it will say who their care coordinator is at the time that the survey was done. So if they end up getting a new coordinator in the future, that can be changed in the youth roster. So I guess you could look at old data to see if they had a different care coordinator at the time. But if they haven't had any surveys done or any of the tools used on them, they haven't been a part of any evaluations, then I guess you wouldn't see that change over time.
Right. We might be, I mean, there's no reason you can't export your data, put that as one of the variables, change care coordinator, number of changes. Sometimes families go through 2 or 3, which is really disastrous for families. We got to figure out how to deal with the turnover issue in our behavioral health and other kind of service provision. But there's ways to do that. A couple other questions we can go a little bit beyond 12 our time, but I know others might hop off. Is the WrapStat only available in the US? We've got plenty of Canadian folks using it, but we just don't have them on the map. So because we don't have any National Wraparound Implementation Center contracts with Canadian providers or provinces, but we would be perfectly happy to do so. And we do have a few Canadian licensees of our tools. So feel free to go make use of the tools and license them, even if we have folks from New Zealand, from Belgium, who have used the tools in the past. So yeah, just bringing it home here. How about at the organizational level? Which organization or site are you? Half of WrapStat organizations have better than 80% completeness on gender. So like, you know, we might only have data for about half of all the youth, but for half of our users, they're collecting this data consistently. Only about a third of our orgs are collecting good, consistent data on race. Only about a quarter of our orgs are getting referral source. And again, only about 5% of our orgs have good, complete data on exit reason. So, you know, certainly if we look at all of our youth, the data is incomplete. We're going to be zooming in on the organization. I'm just going to say it. We're going to, oops, this didn't come out right. We're going to be zooming in on the organizations that have good data to learn from it. All of these sites back here, I don't know what happened to the formatting here. All these sites back here, I think it's about over 30, if you add all of these, this mess up, have incomplete data on exit reason. But over here, we've got a few sites that have 60 to 70% completeness on exit reason. A few sites have 70 to 80, and a few sites have really consistent data. I'm not going to call out sites who are doing the best here, although, you know, I could talk a little bit about New Mexico doing a great job on that. Couple of others who are doing an incredible job. We want more of that because you're going to be the folks we zoom in on to do research. It's going to be a minority of wraparound provider organizations. Maybe 7 or 8 of our programs out of 50 are going to be involved because you have complete data. If we don't have the complete data on fidelity, outcomes, discharge reason, demographics, we're not going to use you in our research because we don't have the data. So, you know, I'm looking here about, will WIRT issue out standards for what criteria constitutes good data? Great question. So that's going to be a real big next step for us, right? We want more folks down here getting consistent data. We got 3, 6, 9, 11 organizations getting exit reason at greater than 50% rate. We're going to need that. Okay, so that's going to be one of our big challenges. Which kind of system are you? Think about it. Are you looking to make sure you've got these data in one place? Now, of course, you might have those data elsewhere, and you're just saying, well, we can analyze that, but we're not going to, you know, it's one more step. But again, even if you have those data elsewhere and you can make sense of those data locally, it's one less thing we've got. I'm going to be real selfish. If we want to learn as a group, as a community of practice nationally, entering these data on discharge reason, length of stay, demographics in WrapStat is going to be the way we can do that together. So let's take a look at the last couple points here. We've got a lot of ideas on next steps with analyses, a couple that you all put into the chat. Thank you for that. We will be able to ask what kind of satisfaction, fidelity, and outcomes are being achieved across the country, and what things contribute or are associated with outcome, satisfaction, and fidelity. Discharge reason, race, gender, age, the type of organization you are. That's what we'll be able to do when we have the data, and that's what we will do, but only with the organizations that we have complete data from. Other things we can do with the analysis, thanks to John for putting some of these in here. How does fidelity affect outcomes? What kinds of other things affect outcomes? The characteristics of your wraparound program, the characteristics of the young people. Could be the turnover that you're experiencing. If we get those data across the 10, 12, 15, hopefully we'll get up to that number of states and sites that have full and complete rigorous data, we can look at these associations. What matters? What is driving outcomes? Can't learn these things without your help, folks. So just bring it home one last time if you haven't already gotten this message. We can work to improve WrapStat. I love the idea that we will start now putting together a report on this and what represents high quality data, both with respect to good response rates to your surveys, good data completeness in WrapStat. Our wonderful research coordinator, Catherine Soon, is going to look at all of the evaluation cycles that folks have used to see what the average response rate is to WFI-EZ evaluation cycles and TOM evaluation cycles. That will be another thing we'll feed back to folks, and it will be part of that question you ask. What represents good quality data? John Danforth, thank you. Which characteristics of the care coordinators are correlated? We can ask that question. We might need to bring, export the data, add in another variable or two, like how long have they been with your program? You know, what kind of things characterize those care coordinators? So we can look at that, but we can. John's answering Jared's question. Thanks for that. So we were doing this webinar style. We can't unmute you, unfortunately. People are doing great stuff in the chat here. Any last questions that I've missed or comments, Chris or others monitoring the chat?
No, I mean, I think so far all the questions have been answered, but if anyone has any other questions, feel free to put them in the chat.
Do we track Wraparound Fidelity Index completed by numbers and by ends and team members? I'd like to see the analysis of that. I guess I'm trying to figure out what NS's is, but I think that the main point here is that our next frontier is to indeed start doing these analyses. John's already doing some really intriguing analysis of natural supports. Thank you. Absolutely. We can do those kinds of things. If you have TOM data that talk about natural supports, you can look at the fidelity data from the parents that say are natural supports on your team, and we can associate that with outcomes, right? Because it's in the fidelity data. So yes, those are the kinds of things we're doing next. John's already on it. So John has been seeing already. So folks know who have read the summary of our big meta-analysis of 16 controlled studies of wraparound, that the studies that had greater number of youth of color, that the sites that had a greater number of youth of color in the sample experienced bigger effects of wraparound, suggesting that wraparound can be a way to make for more positive than typical outcomes for youth of color. John is also looking now at satisfaction and fidelity data by race and ethnicity. Again, we're limited to the number of sites we can do that in by the quality of the data and the quality of the information in WrapStat. If we don't have fidelity, race data in there, it's hard to do that fully. But we do have those data in the fidelity surveys themselves, and John is learning that there are some interesting patterns of difference comparing white youth, white parents, and youth and parents, families of color. That I'll leave you on a little bit of a cliffhanger here while we look at those data. But these are the kinds of things we can do in the future, and we'll be showing to folks in our international community of practice. Lee says, I'd love to see comparisons between youth and caregiver responses. We've seen youth rate the program higher than caregivers in our system. I'm going to tell you something. Lee, you're hitting on something really great here. One thing we've seen over the last, too many to really want to think about years of collecting these data, is that programs and systems that have care coordinator ratings of fidelity that are way higher than the parents usually don't have, and the youth don't have, the best outcomes. When you see similar, even if it's lower on the care coordinators, similar ratings where parents, youth, and care coordinators are on the same page about what's going on, what your strengths and weaknesses are with fidelity, tend to see stronger programs, better outcomes. So yes, looking at the differences between youth, caregiver, and provider ratings can be telling. And that's another thing we can do, John, and others on the team. We should look at the differences between the respondents and ask if that's related to our program survey data in those places we have those. That would be pretty interesting. All right, let's see. Parent youth partner surveys feedback. Yeah, so we also can look at the team member surveys, see what kind of team members are being identified. I know that it's a limitation that only one team member per assessment is able to be accommodated by WrapStat. We know that's a limitation, but we can look at those data as well. Yeah, I'm hearing what you're saying, Jared. You can only match across forms for a small subset that actually have the same respondent, but interesting to compare and contrast differences across respondents. Absolutely, another thing that we can do. Satisfaction scores do typically correlate and outcomes to a lesser extent. That's something we learned from service provision evaluations across the board, that there's some, but not super strong correlation between quality, fidelity, and satisfaction. And even weaker association between fidelity and outcomes, but it's there, but it's not a super strong correlation. There's a lot of other factors that go into outcomes. Yeah, we might be able to look in, we've had a lot of people ask that question. I think that's what you're asking about, Jared, is can we get more team member forms than one for every youth in the roster? We can look into that, but we were basically told early on by our programmers that is the kind of thing that could really make the programming difficult. I think we had to kind of go with that. Maybe we can look into that. Kristen, we'll look into that with 3C, okay? Let's put that on our list of things to talk with them about. All right. Well, thanks to so many of you for hanging with us past the top of the hour. This has been so fun. And I'm just going to say that, to some extent, we schedule these webinars because it means that the team, we don't really get paid to do this. We don't get research grants. It's all coming from, our license fees, and they're not the biggest license fees in the world. So sometimes it can be hard to really focus on analyzing our own data because, we work on a little bit of a shoestring. But when you set a webinar and say, we're going to tell the world what is going on with our data, kind of means we have to knuckle down. We got a deadline. So thanks to all of you for keeping us on track. Had almost 100 attendees. We had a little poll before we started, and I think Katie wins. Katie almost nailed it, exactly the number of participants who are going to show up. So almost 100. Thank you for being here. We're going to keep doing this, and you can always reach out to us at this email address, okay? Nice to see you, Betty, even if virtually. Thanks to everybody. And hey, we'll see you out there in the world, virtually or in the real world. We are going to have a National Wraparound Academy again someday, in a couple of years, hopefully. And of course, the training institutes will be back someday as well. So hopefully we'll see a lot of you in person someday, on the phone, on Zoom. And yeah, have a great rest of your week and 4th of July weekend.